All right. Hey guys, how are y'all doing? We're going to get started here as soon as I get Nancy on the other side, and and make sure that she's a part of this live stream. So welcome to the tips and tricks for the annual enrollment for Medicare beneficiaries. Let me get Nancy on board, and we'll see what we can go do. Bring a friend. There she is. All right, bringing Nancy in, guys. So me and Nancy are going to discuss things going on with Medicare during this open enrollment. And while she's getting on board here, I'm going to quickly let everybody know that people are going to call it different things. Medicare is going to call it annual enrollment period. Hey, how are you doing there, Nancy? How are you?
Hey, I'm great. How are you?
I'm doing great. Let's get everything lined up here.
Okay.
Good morning. God bless. God bless. I'm so happy that we're together on this. We've talked about this for a little over a week now, and I really
Yes.
do feel that God has put us in place to talk to folks in a hassle-free way. We don't come into their home. We don't need tea or coffee. We don't high pressure people. All we're doing is going to talk about the information, so that way people can be informed without being pressured. So, good morning to Nancy. We're just going to get right into a little bit of our backgrounds. I'm Michael C. Fischbach. I run and operate Medicare Savings out of the Holy City in Charleston, South Carolina. And this is a friend of mine, Nancy, and she'll tell you her background a little bit too. Go ahead, Nancy.
Former real estate owner, and that was
Yeah.
before stroke, and now I
Mm-hmm.
help a lot of people get healthy.
Yeah, yeah, and you've done a lot of those because I keep seeing a brand new person each and every day with massive results. Nancy's very humble. She won't tell you like all that stuff, but she definitely has some of her own results that we spoke about yesterday about how you're off of 17 medications. That was right,
I was
something like
on
that.
17 medications costing over
Woo!
$4,000 a year after the
Yeah.
Medicare RX paid, and now I'm only on
Hmm.
4 medications a month costing me $120 a year.
And that is where the rubber meets the road. Health is before health care. And we'll
Yes.
get into those discussions later on, but today it's all about Medicare beneficiaries, what they need to know about open enrollment, and the tips and tricks to avoid the pitfalls today. Because as a Medicare beneficiary yourself, you realize uh, the coverages that you have need to be there for when you need them, right?
Right, exactly.
Right, right. So the first topic today is, or not topic, I'm sorry. The first thing that we're going to go over is just uh, the open enrollment. What are the rights and options? So many people will call you, right, Nancy? Like 30, 40, 50 times a day. I've heard so many stories about you're this or that call and all that stuff. And so I realize that you guys are under immense pressure when it comes to the phone, and we're not trying to do that here for you. We're just trying to tell you that the rights and options, if you want to grab a pen and pad, that's fine, or you can rewatch this. But basically, the open enrollment period, also known as AEP, annual election period, annual enrollment period, was only designed, it was designed for folks to shop their Part D drug plan. Did you know that, Nancy? That's what it's for, to just
Actually,
shop your Part D drug plan.
I did not know that, Mike. I thought it
Yeah.
was for everything.
Yeah, you see, and the commercials come, the mails come. So there's a lot of things going on, a lot of people coming at you, maybe trying to come into your household. No, it's only designed, and you can look at this up at cms.gov. That's the folks that administer
Yes.
Medicare. And so you you're supposed to be shopping your drug coverage at this time, October 15th, which is the start of it today, all the way to December 7th. So
Yes.
that's how simple it's supposed to be. But obviously, the insurance companies, insurance agencies, and everything, they make it out to be more than that. Now, with that said, though, folks that are shopping their drug plan have two different options that they're shopping. So for folks like you, you've already told me you're on original Medicare. You have a separate standalone Part D drug plan, correct, Nancy?
Yes, I do. And I'm not happy with it.
Yeah. You're going to be shopping it. So you're one of the folks that are going to be looking in the information. Well, we can definitely tell you the easy way to go about it now that Medicare.gov, see in the background there, Medicare.gov has updated their plan tool finder. Man, it's so easy for you if you're just a little bit internet savvy, like I'm talking about just a little bit, just know how to create an account, you can keep your information on there and shop it yourself. And
Good.
Medicare is the only resource, they're literally the only resource that shows you all the Part D drug plans available in your specific zip code and area. No insurance broker or agent has all the separate plans available to them. If they say that, they are straight up fibbing. So know that Medicare.gov is a great way to do that. Know that 1-800-Medicare is a great way to do that. And I have
Yes.
a video specifically for that for you to get in touch with a Medicare agent in your part of the country. So look into my YouTube stuff at Michael C. Fischbach. It's out there for you to get in direct contact with a live Medicare agent from the federal government to shop your Part D drug plan. All right, that's one half of the equation. That's one way to coordinate with your Part D drug plan. The other way is to shop your Medicare Advantage Part D drug plan. So Medicare Advantage, a lot of times they bundle up everything to where it's your health care and your drug coverage together. Well, Medicare Advantage is also the alternative option to original Medicare. So I know if that's gone over some folks' head, I have a video and presentation that I'm going to redo
Good.
or rebroadcast out there for the folks of how does Medicare work as your primary health insurance. So obviously that's something if you're confused about. I want to make sure that you're very clear on your Medicare insurance options. So you're shopping your drug plan this year. You either have a standalone Part D drug plan, or you're shopping your Medicare Advantage Part D plan that has drug coverage in it. So Medicare Advantage, Nancy, you're familiar with HMOs and PPOs, right? Like
Yes.
networks.
Yes.
Right, right. But you don't have that issue because you're on original Medicare. You get access to all 10,000 providers nationally. So your coverage goes with you. You have great benefits
Yes.
that you've earned the right into uh, since you paid all those taxes.
Yeah, forever.
Okay. Well, yeah, exactly. A lot of people will have some words to say about that. So that's really it. People think it's a big deal, like right now, to do other things, to shop other coverages. It's smart to be an informed consumer, and that's what I try to make sure happens when you're looking into different things or Googling them throughout the year. Like literally, I'll give you the updates. We have the updates because they come into us. And so there's a couple other rights and options that people can do. They're optional during this time of year. And it's optional to shop your Part D drug plan. You don't have to. If you have good Part D coverage, which a lot of folks, they might be in that situation, then it goes on to the next year because these are year-long contracts. That's why their effective date is January 1st when you first enroll into a Part D drug plan or a Medicare Advantage with Part D coverage in it. Okay, and so real quick, Nancy, I want to go back to the health side a little bit, and because the cost, that's why one of the reasons I simplified the company's name into Medicare Savings is because people have been working so hard for these benefits that they don't realize that some of these costs get very, very exorbitant if they're on a lot of medications, and especially prescribed medications that you didn't plan for. So
Right.
talk a little bit about your prescription costs that you've gone through.
Well, I started out with SilverScript because I didn't have a great
Hmm.
person to help me like you. And
And you don't have to put them under the bus.
it's true. But and then I know that CVS Pharmacy bought out my prescription plan that was just kind of making me scratch my head. But anyway,
Okay.
even with that, I was still paying over $4,000 a year. And
Yeah. Yeah.
thankfully, since I've lost the 52
4,000.
pounds, it's just
Mm-hmm.
crazy. I mean, we could barely afford it. Actually, we couldn't afford it. And
Right.
I am
And that
just
was
so,
for the entire year. The
yes.
4,000 for the
Oh, yeah,
entire year for
over
for
4,000.
medications alone, and that
Medication,
was
oh,
not healthcare related.
well,
Wow.
they paid a couple dollars, but that was it.
Wow, wow, wow. Yeah. And here's the thing. Here's the crazy part. A lot of people don't realize that you can appeal for your Part D, your formulary, your drug coverage. So, and that's just another step that you have to go through. And I realize that people are like busy and everything, but you have rights and options. It says it in your Medicare new handbook, and it says it on Medicare.gov. But if you don't have somebody alongside you that isn't a specialist, or they may be doing other
Right.
things like, I don't want to throw people under the bus, but if they're doing other insurance, like, just say, I don't want to throw any insurance people under the bus, but basically they're doing more than one type of insurance, then a lot of times they're not specialists when it comes to Medicare. And Medicare is based upon your health. That's why you and I are having these awesome conversations, because I see you as inspiring people with their health, and you're advocating that, and that is the most important. It's not healthcare, it's health. So you're I just feel that you're just making sure that people are realizing that. So it's inspiring to me too. I've been working out because of you.
Oh, good.
um, I don't know if I've been doing it as well as you though, but back to the rights and options. So basically, there's a couple other things that you can do while during this time period, and some of the things that people are doing during this time period, other than shopping their Part D drug plan, is if you're on a Medicare Advantage plan and you're not happy with your health coverage, you're not happy that you're not able to see your own doctors, then you're able to switch from a one Medicare Advantage plan to
Yes.
another Medicare Advantage plan. But that's where there's a ton of pitfalls, because you have to have somebody, or you have to be able to do the homework to uh,
Right.
to make sure that the doctors that you want are on that network, whether it's restricted HMO, or a PPO, or something bigger like a regional PPO. You still have to do homework.
Right.
But it, yeah, but you have original Medicare, and like I said, there's over 10,000 providers that accept assignment from Medicare. So obviously, that's the best coverage, hands down, in my opinion. If you have the national coverage that accepts assignment from
I
Medicare,
think so too.
um, so it's somewhere. The statistic is somewhere between like 94 to 98% of the U.S. healthcare system accepts assignment from Medicare. Like, just a few, like pediatricians and a handful of doctors, but most places accept assignment and payment from Medicare, which is the federal government. Okay, so the other option is if you're unhappy with Medicare Advantage, but you're interested in looking towards original Medicare Part A and B. Well, you can look into transitioning back into original Medicare. Now, real quick, everybody listen and replay this if you can. If you're looking to transition back into original Medicare from a Medicare Advantage plan, because you're seeing that your cost sharing is going up, you're using the plan more, the max out of pocket for some of those plans is up to $6,700. So a lot of people don't have that type of money coming around anymore, or they live off fixed incomes. then there's a pretty big pitfall there if you're trying to get a Medigap plan along with that, because a lot of people may have people talking to them like, oh yeah, you can get back in the original Medicare. Yeah, you can get a Medicare supplement. No, no, you have to go through underwriting. You
Yes.
only are guaranteed issued in certain situations, like when you are surrounding your 65th birth month. So you want to make sure that if you're eligible, that you would get approved for a Medigap plan. That's the number one pitfall for when you're trying to, if you're looking to transition from Medicare Advantage to original Medicare Part A and B. Like I said, that's probably going over some people's heads. So watch that video on how does Medicare work as your primary health insurance presentation that I'm gonna redo and rebroadcast probably in the next few weeks. If you have questions of what I'm talking about, for me, comment below. If you have questions about health and how Nancy has helped many people lose a lot of not only pounds but gotten their life back to where they're being more active. They've just changed their mindset from being um, a victim of their health to what Nancy has done. I mean, it's incredible. You've gotten off 17 medications. That just doesn't happen. Like, I don't hear that story. Uh, and you have countless seniors. I talk to countless seniors, and you're probably the only story that like has stuck out that way. So, praise be to God for that.
Amen.
um, so the last couple things for your rights and options is, if you're looking to go on to the Medigap, and this is the last thing I'll say about the Medigap. And remember, Medigap is the opposite, or the coverage that covers the 20% cost sharing, like co-insurance, deductibles, co-pays, that original Medicare doesn't cover, Part A and B, hospital and medical coverage. So the Medigap covers those gaps, and it all depends on the particular plan that you're on how much it covers, but it covers a lot, especially when you have, just for instance, I had a client that had back surgery. They had a 32 grand claim. Yeah, 32 grand. Even
Mm.
trying to cover 20%, even trying to cover 20% of that, that's still a big bill, you know? And so she came to me and she was like, it was actually her mother. I'm sorry. Her mother, she came to me and she's like, are we good? Like, she had that question. I'm like, I'm so glad that I was able to talk with them last year and make sure for one, they weren't overpaying, or that I got them to where they're at market value, and they're on a plan that, yeah, it covers those things. The only out of pocket cost that they have is the Part B deductible, which is 185 for 2019. And I hate to date this, but basically, they had very minimal out of pocket, just the monthly premium and the Part B deductible. So, since she isn't in good health and she has to go to, the doctors a lot now, and probably has some other services that she's using for Medicare, Medicare is getting those bills or those claims. And Medicare, original Medicare, folks, it is electronically filed and automatically paid. It's automatically paid by original Medicare, which is the federal government. And your Medigap plan, by law, since they're standardized and federally regulated, have to pay out the claim. They have no say. They have no say. So that's why your coverage is so great with your plan right now. So if anything, God forbid, were to happen to you and you go to the hospital, and nobody likes to spend nights at the hospital, even if it is a really nice place. Those are expensive nights. And if anybody has been in the hospital, you know exactly what I'm talking about when those EOBs come in and those Medicare claims come in. So yeah, that is the meat of it. I mean, it's not a whole big thing out there where people are telling you, do it now, do it now. You don't have to do it now. No, 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 no. You have the right and the options to shop for your Part D drug plan. If you're on a Medicare Advantage, you have the options to shop your Medicare Advantage plan that has prescription drug coverage. Um, if you're unhappy with your Medicare Advantage plan, you're looking to original Medicare, avoid the pitfall of making sure that you're approved for a Medigap plan. And if you're looking just to shop for your Medicare Advantage plan to another Medicare Advantage plan, this is the time to do it as well. The last thing I'll say is that we help people 12 months throughout the year because folks that have a Medigap plan, they're not one-year contracts. We can help folks 12 months out of the year. But it just so happens
Good.
that a lot of the companies, they change or adjust their rates at the end of the year or at the beginning of the year, and sometimes in the middle of the year. So we never know. The companies are the ones that decide when that happens, when they file it with the State Department of Insurance. So we're the ones that have to be accountable to you. So whoever is out there and you don't have anybody that is accountable to you, they're licensed and trusted to do so by law. So if you have Medicare questions about your insurance policy, if they're not answering them, I would seek a second or third opinion. Typically, I am a third or fourth opinion when they come to me. They come to me and they're like, why am I paying $400 for this plan? I'm like, well, the market value and these companies show you it's right at $100. I don't know why you're paying. I don't know why you're overpaying. Do you know? And then we just try to help them. So, but I want to tie this back to health because that's the most important determinant when you're looking, say you're brand new to Medicare or you're about to get off your group health insurance, you're looking into your Medicare options. You should determine your Medicare insurance options based upon your health, and what is important to you in the long term, because Medicare is your last insurance, correct, Nancy?
Correct.
Yeah, yeah, you're not going to go on anything else. And so that journey is typically fairly long on average. I'd say, Nancy, it's like 20, 25 years, and now it's growing to even more for some people. I've had a client that was 95 years old, was 95 years old. And so, that she was on Medicare for a long, long time. So you got to make sure that uh, when you get information from people and they're pressuring you, you want to question why are they pressuring me? It's your decision, right, Nancy? It's
Exactly.
not their decision. Yeah, yeah. So let's tie this back around, and then we'll give you the tips and tricks to avoid those scam and fraudulent activity calls that you get. But I want to tie this back around to Nancy real quick. And so, Nancy, so you're unhappy with your drug coverage. You've been on a lot of medications before, and so what do you think that you would have to do to shop your plan? Because I want to get your perspective.
Mike, it's really, I know people like me are probably really, it's kind of scary. I mean, because Medicare is just
Mm-hmm.
so doable, but people don't realize that.
Mm-hmm.
And then when you click,
Mm.
you're online, because a lot of us older folks, get online because it's easy. And then you hit the wrong number. And
Mm-hmm.
like you said earlier, last year, I know I
Mm-hmm.
had 30 phone calls. I'm like, really? Because they gave my phone
Mm.
number to all, probably hundreds of people. It was just ridiculous. But thank God for
Yeah.
people like
Yeah.
you that truly work for the government that can help
Mm.
us see that this is really simple, you
Yeah.
know?
So this is our segue into those calls because that's a real issue. And so I've actually spoken to a number of folks that try to help with those calls. Um, and one in particular, I'm not endorsed by him or anything like that, but I've talked to him on the phone. We've gone email back and forth. His name's Aaron Foss. He actually won the FTC challenge for robocalls in 2013. And he built a company called Nomo Robo. So if you have a landline, and I'm probably giving away the secret here, the tips here, but I'm giving it away a little early. But if you have a landline, it's free. It's free to block those calls. If you have a what you call it, a smartphone nowadays, I mean, I think it's a nominal charge for him, but literally, if you have that getting a ton of calls, you can get them filtered. And so not every call you want to filter, because you want to get let your family members and friends call you,
Yeah.
and people that so there is like you need to make sure you don't block everybody. But the way that I have found best for my clients for to shop their Part D drug plan is, if you have somebody that's accountable to you, you can ask them, like, hey, how do I get the lowest annual out of pocket? Well, like I said, Medicare is the only one that provides all the companies' information to you and which one's at the lowest annual out of pocket. So that's why if you go to Medicare.gov, I don't have it up right now, they have updated their plan tool finder, and I know it can be daunting to be on the computer and look at all this information. But if you have a service like ours, Medicare Savings, we're able to advocate for you because we're licensed by the state, and we're trusted to make sure that we help folks, you know, with their coverages throughout the years, especially during open enrollment. So we can advocate for you, but you can easily do it online, Medicare.gov, get on the health and drug plan tool finder, pump in your information, and create an account. And that drug information will actually stay in there. And you can see your MSN, and you can check your
Mm-hmm.
Medicare summary notice. So you now more than ever have all your information at the tip of your fingertips now more than ever. But it's great to have someone telling you, or someone letting you know the tips and tricks that, hey, this is a great way to do it. You shop this way. If you have any questions, come back to us. If you need to talk to Medicare and you still feel unsure, we'll call in with Medicare with you. They'll verify you, they'll verify me. That way you feel safe and secure, because that's what it's all about now, is because so many folks feel unsafe over the phone. And so
It's
you
true.
got to make sure that you're speaking with people that are licensed by the state. They've gone through the federal background check. They're appointed by the companies, gone through another federal background check, and they should give you that license, give you their appointment number. If they're legitimate, if they sway from that, it sounds as if they might be shifting away from giving you their information. They should just give it to you right away. That way you know that they're licensed, appointed, and then if they're Medicare specialists, they're going to do their homework with CMS, and CMS has a national training center that certifies folks for talking about Medicare and the things that surround the Medicare coverages and Medicare insurance options. So if they're all three, that's a pretty good indicator. Um, Last thing about verifying folks, after you have looked them up and verified them and Googled them, they should have a track record. They should have a track record online, especially if they've been doing Medicare for years and years. They should have a track record. And so make sure you just verify that who you're speaking with, and make sure that they have a service for you that is with you for the long term, because Medicare, if they leave you at turning 65 and you don't hear from them, and your rates rise up to 100, 200, $250 above market value, they're making more money off you because your rates are raising. We're doing the exact opposite. We are making sure that you're staying at market value if possible, if you can health qualify a lot of times with Medigap plans. But um, if you have questions, I implore people to look into the information. Google is a great resource to do some homework on your Medicare Advantage, make sure your doctors are on there. Um, we have more tips and tricks for you. I wish I could blurt them out right now, but go to my YouTube channel, and I'll be posting more stuff there. Um, and Nancy, if they want to know more about your health, and we're going to do more of these, right, Nancy?
Yes, we are.
If they want to know more about like healthy living and how you were able to help people and how you were able to drastically change your, your own health, how can they find you?
My Facebook page is Nancy Branton Bunch, and they can go
Okay.
there. And I've got dozens of transformations, mine, my
Mhm.
husband's. And the kicker
Awesome.
with me is that I had a stroke 5.5 years ago, so I can do no activity except walk with a cane and with my walker. And I lost 52 pounds
Hmm.
in 5 months using nothing
Wow.
except I work for a non-GMO company. Our products are no
Hmm.
preservatives, no artificial flavorings, no artificial sugars. And I love it. I love it. It is the best thing it has saved my life. And I just love it. I would love to help you. That is my passion. So look me up and let's get this
Yeah.
done because I'm off 14 medications, guys. My husband is no longer
Yeah.
diabetic and I am 67 years old. So
Wow. He's no longer diabetic?
no.
That's crazy. That's great. See, you keep on surprising me because like from 17 to 4 medications is gigantic, gigantic. And then now your husband, you're just telling me that he's no longer diabetic, doesn't take insulin, doesn't take metformin pills or anything.
Nothing, nothing. He was full blown diabetic, and the doctor was going to put him on
Wow.
medication. And he said, "Please let me try something." And when he went back to the doctor in
Wow.
3 months, he had lost weight, and then in 6 months, he had lost 85 pounds off of the CPAP, off of any diabetes medicine, and off cholesterol.
Wow.
So
That's pretty amazing. So health
amazing.
before healthcare. Oh my goodness. Well,
Nutrition.
we're this is a little bit of disclaimer. We're not doctors, right, Nancy? We're not, we're not advocating to go against your doctor or anything like that, but you know, it's just a trend going on with American health that everyone can look into and see that we're one of the most not just wealthy nations, but obviously, our we just have a lot of ill health and health issues later on in life, and so I implore you, don't just look at your own like coverages and everything. Look into Nancy as well. Make sure that you get more information about your health, and make sure that you get the correct information. Don't be pressured by these phone
Right.
calls about getting your information. Last thing I'll say is that uh, here are some of the activities you need to look out for. So if you get calls about genetic testing, cancer screening, or durable medical equipment, or calls from Medicare, those are all fraudulent calls, fraudulent activity. Medicare will never call you. They
Right.
will never call you. You call into them. That's what our hotline is for. You call into us, so that way you get the information. So you get the information via email or your phone or what have you, and then make your informed decision after you get your information. So, guys, that's all we have today. We're going to talk more about all the things that are going on throughout this Medicare season, but we're going to talk about health too with Nancy. So we're going to do a couple more. I'm going to tie her down right now. We're going to do a couple more, right, Nancy?
Right. We're going to do that. We're going to get America healthy.
Oh man, that would be a lot. That would be amazing though. So God bless everybody. If you have
Amen.
questions, yes, man. If you have questions about what we spoke about for the 2020 Medicare open enrollment, also known as annual election period, annual enrollment period, if you have questions about that, you can contact me at mike@medicaresavings.us or type in Michael C. Fischbach on Google and you can find me. If you have questions about health, you talk to Nancy, because it sounds as if you're a Medicare beneficiary and you feel that your health is going in a direction where it's going more and more medications, man, it's I wish it was the answer to go that way, but it doesn't seem to be, from all the people that I've spoken with, all the the studies that are going on with folks' health about adding medications to make this symptom go away. So this symptom, add another medication. So it's very tough on y'all to live with a ton of medications. And I know as well because my mom passed away from bile duct
Mm.
cancer last year in July. So guys, looks like we have a phone call coming in or whatever. But y'all take care. God bless. If you have questions, please comment below. Nancy, thanks so much for doing this with
Thank you
me.
so
It
much.
means the world to me. So
Yeah, thanks,
take
Mike.
care, y'all.
Awesome.
Please
Okay.
like, subscribe, and share on all this stuff. Bye, guys. Take care.
Bye.